This is a very important. The road traffic accident as orthodontic treatment was going on, waited for some time and had an orthodontist opinion. When it was about the complete the treatment, only then we started with the prosthodontic procedure. So implant placement and the correction, it's a last thing to be done after the correction of other aspect in dentistry. Okay? Because we cannot do any more of the implant in the course of the treatment. So the access hole was closed with gutta percha and it was again. Now open tray impression. The occlusal clearance from the implant, as I have already explained to you, it should be 7 millimeters above the plane of occlusion and there is a good amount of intra-space. This is what it is. 4 implants are placed in the anterior mandible, restored, which you have seen earlier also. This is the closed. I told you the maintenance phase. So she came after 5 years, I think. Again, I removed the prosthesis. This is how we made the prosthesis. Splitting the transfer coping because we needed to take the thing all together. So it should be oriented with each other the way it is positioned in the patient's mouth. So it has to be splinted with pattern resin. There are some literature they say use composites and use self-care. Don't use them because the polymerization shrinkage is very high with those things. And these particular things, they have a specialized glass, finely grown glass mixed with the resins. The glass they do not contract, whereas the resin contracts. So that minimizes the resin contract. So as a prosthodontist, what we do is, we make all the copings around it, the transfer coping 24 hours ahead. We'll minimize the gap between the transfer coping so that there is minimizing the polymerization shrinkage. So we make an impression, attaching the lab analogs, reproduction of the cast, Facebook transfer, wax pattern, casting, trying in the patient's mouth. Now these are the conventional methods which I used to do earlier. Now I'm old, I have no time. So this is the fabricated process in the patient's mouth. And the soft tissue after so many years of function. We have good reasons here for the ease of training. Moreover, this patient is diabetic. So we have to be very careful in creating access for the self-cleansing mechanism. This is after 12 years. Again, can you see the conventional processes and to the implant process, the profile changes. By doing so, we can increase the vertical dimension nicely. We can restore the last middle third phase collapse. That is one advantage of the implant. No? So again, we do have this patient. I want to buy one. So poor maintenance. Again, a problem in implant dentistry. Now, because of the presence of the CAD-CAM, the procedure we have eliminated, the conventional last rack technique has got, and the precision is very high. Advantage, it gives a very precise process, cost factor less in weight. Disadvantage is it needs a very skilled technical procedure. That is that early. So this is, can you see the difference between the last wax technique to the CAD-CAM? And this is the case with the CAD-CAM. Gingival porcelain because it was a road traffic accident. Appearance of the face, intraoral appearance, and the process is secured over the implant. This is another case. I'm just making you familiar with how we manage the institute. You would ask me a question why I retain this thing. Because once the patient becomes edentulous, regaining the last vertical dimension is very, very difficult. Having few teeth in the mouth, because of the proprioception, you can regain your last vertical dimension. So always restore the lower arch if you are doing a full mouth restoration because that is a mobile component in the masticatory system. CAD cam again, finish restoration, the racks are sold. Similarly, maxilla, complete identity arch. 5 implants are placed, intraoral upgradings, smile line. Yes, again, there is no clear indication to say you can go for processes in porcelain depending upon the cost factor. Okay, cost factor. This is accurate. Of course, the PPS, it's again the PPS. Overdenture. Again, the relative balance matters a lot here. Yeah? These are the dangerous things that you can come across in overdenture. Sometimes the severe resorption you may not get to see the keratinized soft tissue. You get to see only the loose connective tissue. So the formation of calculus, peri-implantitis, these are the patients that are prone for the peri-implantitis. So we needed to monitor them very carefully, and we have to teach them how to clean the area. Overdenture with magnetic attachments. These are all magnets. This we give for the patient who are extremely old, a geriatric patient. Any mechanical components very difficult for them, that's not it. But which is not so. So prosthetically you can change your component based upon the age and also the skill of the patient. Yes, we wanted to make a little more money with the implantation. It's good enough if you have 2 implants in the case of mandible for an overdenture, 4 implants in the case of maxilla for an overdenture, not beyond that. Yes, 5 years of follow-up. As I told you in my beginning, I'm married to my patient. Here is not the looks, how the implant behaves. So this is a congenital abscess of lateral incisor. She had a midline diastema. It was corrected. Then we placed the implant. It was possible only because of the absence of lateral incisor, the soft tissue thickness was very minimal. So I have to go for a cement treatment processes with a short soft tissue thickness and modify the crowns. Any orthodontist here? Kindly do not ask me the question why I did not remove the composite. The phone I told her you live with that, it's your fate. Can you see this? She was very reluctant. So this is soon after the cementation, and she came back and she was married with a couple of kids in her hand. She came after 5 years. This is a close-up view. Still, she lives. This is another case where the soft tissue thickness was so much, we have to modify the abutment by ourselves, and we manage the case beautifully. Screw retain processes. This patient he had a fall in the bathroom. He tripped over the foot mat. The soft tissue thickness was very, very minimal. So we managed with the non-segmental processes.